How's it going, everybody? It's Nurses Week 2018, and we're at our first poster session. Let's find out what some of our nurses have done for work this year. Come on. So we're here with Kim, and Kim works out in the Waltham OR.
Yep.
And what is your poster about?
My poster is about developing an educational program so that we can provide a more affirming environment for transgender patients that come in for surgery or other procedures.
What did you learn? What's one or two takeaways?
Well, one of the most important things I learned, or the thing that sort of sparked my curiosity, was that I started reading some published literature of what some of these children go through before they actually get to the point where they're coming for surgery. And some of the statistics are pretty harrowing. And so here's an example of some of them. This is a study done in ages K through 12. This is some of what these kids go through: physically attacked, sexually assaulted, verbally harassed, all because their sense of inner self really doesn't align with the gender they were assigned at birth. So once I started learning, I realized there was so much more to learn. So much more we can do to make them comfortable when they come into the hospital. And I knew, I'm a nurse with 30 years experience, there's got to be so many more nurses out there that need this information. And so I just developed an educational program, which is featured here. It took place over 6 months. We had several expert speakers come in. We did a knowledge assessment for staff to see what they did and didn't know, and we're trying to measure what they're learning along the way. So,
awesome. Great work.
Thank you.
Good. All right. Hey, we're here with Deb. Deb and Shelly are actually award winners. I just want to point that out. And Deb works on 10 East. And do you want to tell us about your poster?
Happily. I just want to first say thank you to Shelly, who's my mentor. The program is wonderful. I learned a lot in the process. And I chose my project on safe sleep knowledge and compliance for caregivers because I work on the infant child group. We give a lot of babies. And safe sleep is definitely an area in our unit in the hospital that we have a lot of area to learn about and work on. And there was limited evidence for our unit in terms of how to provide safe sleep. So a little history on AAP guidelines. They were updated in 2016 and included a line that in hospital settings, hospital nurses and physicians should teach and model safe sleep for parents and caregivers.
So when I have all that stuff in the crib with my patient, is that not a good idea?
That's right.
Really?
Yeah, we have some work to do.
Really?
Yeah.
So what should it look like? What should we do?
So there are multiple guidelines for babies and under 1 year of age that are fit the criteria. But flat bed.
Yeah.
Hard surface, so we have sleep sacks, not multiple blankets, all those cute toys we put in a bin. We don't want anything on the bed, no bumpers, and we teach parents that co-sleeping isn't safe. We work on keeping the patient not too close with thermoregulation, and they really want us to both model and teach. So my focus was how to help parents learn best.
Okay.
So what I learned through the process of this ABP was that multimodal teaching. So modeling, teaching with language, teaching with reinforcement papers, video teaching, all of that bundled is the best outcome for families after discharge.
Awesome. Great work. Congratulations on your award, too. All right, we're here with Katie from GPU, and she's going to tell us a little bit about her Nurses with poster.
Hello, I work in the GPU where we do outpatient procedures, and it seemed that we had a lot of no-show and decreased start times. So I wanted to study implementing preoperative nursing phone calls, and my topic is preoperative phone calls in elective outpatient pediatric patients decrease same-day cancellation rate. And the evidence does show that it decreases same-day cancellation rate by 50% by identifying top reasons for cancellation, including not adhering to fasting guidelines, acute medical change in clinical status, and no shows.
Awesome, great job. So next poster, we're here with Nancy and Renee. They work on 7 West, and they did a poster about SIM. Tell us about it.
We did a poster about SIM. I'm Nancy Jones. I'm one of the nurses on 7 West. It's a medical inpatient unit, and we were both part of the mentorship program for evidence-based practice. And we decided to come up with this question based on an issue that arose on our floor. We had a code situation, and we realized some of our nurses were not trained. They didn't know what to do when they got to the bedside, and we thought that a little bit of education was necessary. So we came up with this PICO question.
So we focused on the non-ICU pediatric nurses, and mostly with the low volume, high risk scenarios. So we looked specifically at the confidence level and how high fidelity simulation improves nurses' confidence in caring for deteriorating patients through that practice.
Does it?
And what we found was that evidence shows high fidelity simulation in fact does improve nurses' confidence. And we also found that further studies are needed, such as a quality improvement project, which is something that we're looking forward to doing within medicine to try to get simulation going for our nurses.
Awesome. Great job.
Thank you. Happy Nurses Week.